السلام عليكم ورحمة الله وبركاته. الحمد لله نستعينه ونستغفره ونؤمن به ونتوكل عليه ونعوذ بالله من شرور أنفسنا ومن سيئات أعمالنا من يهده الله فلا مضل له ومن يضلله فلا هادي له. سبحانك لا علم لنا إلا ما علمتنا إنك أنت العليم الحكيم. رب اشرح لي صدري ويسر لي أمري واحلل عقدة من لساني يفقه قولي. Respected ulama, brothers and sisters listening on the online platform, I greet you with the greeting, the universal greeting, Assalamu alaikum wa rahmatullahi wa barakatuh. I'm really privileged and honored to be addressing you today and spending the morning with you with a very important topic related to one of the fundamental pillars of Islam, the pillar of fasting, and particularly with my expertise from the medical side, we will talk mainly with regards to the medical aspects and how it impacts on the fiqh of fasting. So, alhamdulillah, it's important whenever we endeavor on doing any deeni activity, our niyyah has to be corrected. And inshallah, we do this purely and solely to earn the pleasure of Allah subhanahu wa ta'ala. We ask Allah subhanahu wa ta'ala to accept the sitting of ours as a means of ajr for us and a means of earning His pleasure, inshallah. Very importantly, I've decided to discuss this topic partly because we are on the doorstep of Ramadan, but also of recent times we've understood that medical science has advanced in leaps and bounds. And because of this advancement in medical science and medical technology and therapies, there have been many different scenarios that have been posed to the fuqaha, the Islamic jurists, that have never been ever posed to the jurists of this ummah. And these contemporary issues and questions require a lot of deliberation. But alhamdulillah, our deen is unique in the sense that it's based on solid principles that have been laid down by our akabir fuqaha, the ulama that came many years before us, and they've set down some very rigid principles that the contemporary fuqaha of our time merely have to apply these principles and arrive at answers to many contemporary issues. So particularly with fasting, and because it's such an important aspect of our deen, we also have now encountered many issues from the medical side that impacts on fasting, and that's what I want to discuss with you today. Importantly, as you can imagine, because these are questions that have never been posed to fuqaha before, there are differences of opinion, and they are valid differences of opinion based on principle. And I won't go into issuing a particular opinion. However, I will discuss the various opinions, and we will leave your local fuqaha to rule on which opinion should be followed. So, alhamdulillah, you know, one of the important things is, alhamdulillah, Allah has given me the opportunity to sit on both sides. I have medical experience and have I would say a small exposure to Islamic jurisprudence or the fiqh. And when I sit on both sides, I'm able to see very clearly how both sides approach a particular question. And I want to make it clear that, and it's part of the principles of the fuqaha, that there is a close dialogue between the experts in any field and the mufti or the fuqaha before a ruling is made. And this needs to be emphasized. So the fuqaha do not make rulings without discussing a particular field, in this case the medical experts, before making a ruling. And as I say, I won't be issuing any fatwa today. The scope of my presentation, we will do a bit of a brief discussion around fasting, the definition of fasting, the fiqh aspects of fasting, but in a very brief way. The main thrust of my discussion today would be with regards to principles on the invalidators of fast, also with regards to new medical procedures and how they impact on fasting, and medication, certain medication that were never found before in the history of this ummah, and they present questions for the fuqaha today. So quickly, what is fasting? As we say, the linguistic or lughwi meaning of fasting means to abstain, and the istilahi or the sharia definition of fasting is that we abstain from entering anything into the body. And again, we will discuss what entails the body intentionally or accidentally, as well as abstaining from engaging in sexual activity from the time the sun begins to rise till the time it sets, along with the intention for fasting. Each line on the definition is important, and the fuqaha have made that very clear. Now, where do the fuqaha obtain their rulings regarding fasting? The primary source is obviously the Quran and Majid, and I just thought we'll touch on some of the ayat of the Holy Quran that make reference to fasting. The first ayat of the Quran, Surah Baqarah, Allah says, Ya ayyuhalladhina amanu kutiba alaykumus siyam kama kutiba ala alladhina min qablikum la'allakum tattaqun. That, O believers, fasting is prescribed for you as it was prescribed for those before you, so that you may learn restraint. Again, this whole concept of self-restraint and spiritual development. And again, this is an amr, this is a command that is made fard on the Muslim ummah. Secondly, the ayat we find in Surah Baqarah is Ya ayyaman ma'dudat فمن كان منكم مريضا أو على سفر فعدة من أيام أخر وعلى الذين يطيقونه فدية طعام مسكين فمن تطوع خيرا فهو خير له وأن تصوموا خير لكم إن كنتم تعلمون. That fast the prescribed number of days. Now these are the important parts. There are exceptions to this. And again, this concept of there's wus'a in our deen, and deen has allowed for certain circumstances. Here in this case, except if any of you is ill, which is particularly what we will be talking about today, or on a journey, let him fast a similar number of days later. For those who cannot endure it for medical reasons, there is a ransom, the feeding of one poor person for each missed day. But if he feeds more out of his free own will, it will be better for him. However, if you truly understand that rationale of fasting, it is better for you to fast. Again, this is not an exact translation, but it's a mafhumi, as we say, understood translation. And the third ayat I thought I'd bring to your attention that the fuqaha look at is this very famous ayah. I will go through the translation. It is the month of Ramadan in which the Quran was revealed, a guidance for mankind with clear teaching showing the right way and a criterion of truth and falsehood. Therefore, any one of you witnesses that month should fast therein. And whoever again is ill or upon a journey shall fast a similar number of days later. Allah intends your well-being and does not want to put you to hardship. He wants you to complete the prescribed period so that you should glorify His greatness and render thanks to Him for giving you guidance. So these are some of the ayat that the fuqaha have looked at. Now, using the various methodology, fuqaha have extracted various conditions and principles and validators of fasting. So with regards to the conditions of fasting, who is fasting obligatory on? Firstly, the spiritual and mental qualification. So anyone who is a Muslim, he has the capacity, we call it an aqil person. Anyone who is mature, baligh, bulugh on the side of the males would be when a young male would experience sexual emission, and in the female it would be menses. That would start the period of bulugh. The second condition is physical qualifications. That means you have to be of sound health to fast. If you are not of sound health, then the Sharia gives you leniency with regards to whether you should or should not fast. And secondly, with regards to physical qualifications, you need to be a resident. If you are not a resident, you have an option when you are on travel to fast or not to fast. Again, as the ayah that I mentioned before allude to. And third condition is the qualification of the will and purity. Importantly, fasting requires us to have an intention. The intention is fard, it's obligatory. And secondly, the issue of purity, particularly amongst the women folk, that the woman needs to be free of menstruation, that is hayd, and postpartum or postnatal bleeding, which is nifas. With regards to those who are not obligated to fast, those children that are under 12, obviously it's not an obligation on them, but we know that many children do fast. Then we got the patient or the person that is incapable of fasting due to many reasons. And I've listed the reasons there. We'll just run through them quickly. Again, physical weakness is one. You know, you've got a patient who's acutely ill, he's in hospital, he's admitted, he's is really not well, then the Sharia gives him a leeway not to fast. Then you've got people who are terminally ill, people with chronic illnesses. So we know that people, for example, a person who's severely diabetic is dependent on insulin. If he doesn't eat at certain times of the day, his blood sugar would drop. Then we get patients with mental illnesses who have either, due to mental illness, they have no insight, so they have no aqal, they have no capacity to concept or have the concept of the obligation of fasting, or there's this purely mentally unwell to fast. The next category of people who we find the Sharia has given leeway is the pregnant or breastfeeding mothers whose health and the health of the child will suffer from fasting, the menstruating woman, as we spoke about, and the ones that experience postpartum bleeding, and those who are obviously traveling. Importantly, I brought the slide in with regards to intention. Intention is important, particularly with regards to fasting in the month of Ramadan, so that we are expected to make an intention. It's obviously sunnah to make it verbally, but an intention in the heart is also counted as an intention. Why it's important that I put up the slide is in the purple arrow areas, that's the time that the intention needs to be made. Once we enter the time frame between tulu'u subuh sadiq, the red line, and for example, a woman, her hayd happens to stop during that period, then she would not be obligated to fast for that day. Same with a woman who is experiencing postpartum bleeding. Same, for that matter, a person who just enters Islam. If he enters Islam in the red zone, for that day he's not obligated to fast. Just a little bit with regards to these concepts of those people who are given, the Sharia gives them leniency with regards to not fasting. There are three categories. One is a person who is allowed to make qada. So he's making qada for a must fast that the Sharia gave him the leeway not to fast. And this is generally to make up the fast a day out of Ramadan. These are for situations, for example, the traveler or the woman who was experiencing her hayd or nifas. Secondly, we have a category called fidya. Fidya is atonement. Generally, it's for the people who are so ill and frail who will never be able to make up for the fast and we're unable to fast during Ramadan. This is particularly with those who are terminally ill and there's no chance of them ever making up for the fast. Then you have the concept of fidya. And then we have this concept of kafara. Kafara is the compensation for somebody who has deliberately broken his fast. So somebody who in the month of Ramadan has deliberately, for no particular reason, broken his fast, then we know that he has to make up for that with kafara. Kafara is fasting 60 consecutive days out of Ramadan, or if unable to do that, to feed 2 meals for 60 days to a poor person. Now, the main thrust of my talk today would be with regards to the principles that the fuqaha follow with regards to those things that invalidate the fast. So we understand who fasting is obligated on, which people have leniency with regards to not fasting. But many a times as medical practitioners, we get the question, is this particular medication, would this particular medication break my fast? If I were to go under this procedure, can I still fast and have this procedure? And this has become a great challenge because there's a lot of contemporary questions related to advancement in medical sciences that have posed these questions. So importantly, I thought I'll start up with a schematic diagram to show you the principles that the fuqaha have laid down on how to assess whether an agent becomes an invalidator of the fast or it doesn't invalidate the fast. So this brief schematic diagram will help us to understand it. So there are 4 categories on this slide, and I'll go through each of them. Firstly, you have what we call a qualified agent. A qualified agent called a wasil is something that has a body to it, something that is tangible. It has to go through a qualified passage, or we call it the manfadh mu'tabar. That means it's an opening on the body through which this tangible item would enter. Then we have the concept of the qualified cavity. This is al-jawf al-mu'tabar. This is the cavity of consequences, where if any agent were to reach that cavity, then it would nullify the fast. And together with all this, the process has to also be followed. A particular process has to be followed to nullify the fast, which is called al-wusul. And all this takes place provided there is no mani', so there's no absolving state. So if all these processes are followed and we tick the boxes on each one of these, and there is an absence of the absolving state, then this would be considered a nullifier of the fast. So, yeah, briefly, this slide speaks to the same thing I just spoke about. You have a qualified agent that enters through a qualified passage. It gets into the qualified cavity through a qualified process, and provided there are no absolving states present, this would invalidate the fast. So what is a qualified agent? So the fuqaha have looked into the sources of fiqh, and the qualified agent is either a liquid, a solid material, it's nutritious and non-nutritious. So this is important, edible or non-edible, nutritious and non-nutritious. So often, to the layperson, it's generally food items that would nullify the fast, but it's important that the fuqaha have specified that the item that enters the passage can either be a nutritious or non-nutritious item. It could be a edible or non-edible item. It could be a piece of lead or a piece of rubber somebody chews on. And it can be soluble or non-soluble. With regards to the qualified passage that this qualified agent has to enter, again, the fuqaha have dug up and they've laid down these principles, and the qualified cavities that they speak about is the throat, and I'd explain to you which part of the throat is considered the qualified cavity. The stomach, obviously most of us are aware that the stomach, and obviously that comes to our minds the first, that nothing should enter the stomach. But the stomach is one qualified cavity, and then the intestines. The intestines run from the first part or the last part of the stomach called the duodenum, and runs all the way right down to the rectum. That is considered the intestines. This is just a schematic diagram to show you, that's the entire cavity that we are talking about, right up from the area called the pharynx, all the way down to the area called the rectum. That would be considered the al-jawful mu'tabar, or the qualified cavity. So anything that were to enter this cavity would nullify the fast, provided the other all other qualifiers are in place. With regards to the qualified passage, so we said that this qualified agent would need to pass through a passage. A qualified passage is any opening on the surface that is communicating with the qualified cavity. So the easiest example is obviously our mouth. Our mouth is an opening that opens outside to the outside world, but it also communicates with the throat and the stomach. So this is obviously a qualified passage. But what becomes a little bit more difficult to understand is, for example, the ear. Would the ear fall under the category of a qualified passage or not? Because it is a passage. Does it communicate with the qualified cavity? And very importantly, because we have issues now with regards to contemporary fatwa, fuqaha have to look into the fact whether the ear qualifies as a passage. I've put the perforated eardrum will qualify it, because if the eardrum is not perforated, then whatever is put into the ear passage generally does not reach the qualified cavity of the throat or the stomach. Same with regards to the nose. The nose is a passage that opens up to the exterior, and it does communicate directly with the throat. So the nose would fall under the category of a qualified passage, or a al-manfadh al-mu'tabar. Then other technical things that come about. So we do a procedure where we put a feeding tube into the tummy. It's called a gastrostomy tube. So this procedure is done for people who cannot swallow food, who are laying in the ICUs for long term, or who are at home. Some patients who are at home and they've had major surgery on the head and neck area. They are otherwise well, but they've got a gastrostomy tube. And now with anything entering, would this gastrostomy tube be considered a qualified passage? Yes, it would. It's an opening. It's going directly into the qualified cavity. The qualified process. Now, amongst the fuqaha, the different madhahib have different opinions on with regards to the qualified passage or the qualified process. I will be quoting the Hanafi madhab on this. The qualified agent must not be seen once it enters the cavity of consequences. So the cavity of consequences, as we mentioned, was the qualified cavity, al-jawful mu'tabar. So whatever has to enter that must not be visible once it enters. So it makes sense. Once you put something in the mouth, it goes all the way, then you cannot see it. But the fuqaha specify that it must have independent stay. That means once it gets into the qualified passage, it must have no way of coming out. And this for me is very intriguing because the fuqaha spoke about this many centuries ago. And today in medical science, we have a procedure called the endoscopy. So we put a scope in, it goes into the tummy, and we are able to pull it out. So technically, instruments like that do not have independent stay. The fuqaha have mentioned this whole idea of tying a piece of meat to the end of the string and putting it into the stomach, and you are able to pull it out. And if no remnants of the piece of meat remain in the cavity, then that would not be a nullifier of the fast. So that is with regards to the process itself. So the agent has to disappear from view, and it has to enter the cavity of consequences, and it must have what we call independent stay. With regards to the absolving state, that must not be found before it becomes an invalidator. So if, for example, you have the four processes, you have the qualified agent entering the qualified passage through the process and entering the cavity of consequence, but it was done forgetfully, then this would not nullify the fast. So forgetfulness, or nisyan as we would call it, would not nullify the fast. The second one is arduousness. This is a situation where it's unavoidable. For example, we enter a room full of smoke, and it's almost impossible not to inhale the smoke. As we know, inhalation of smoke voluntarily would nullify the fast. So anything that reaches a situation where you are unable to control the situation, this aspect of arduousness, then this would not nullify the fast. Very importantly, we must, for example, forgetfulness must not be confused with accidental. For example, if you are gargling your mouth during making wudu, and accidentally water were to go down the throat or into the cavity of consequence, that would nullify the fast, as opposed to you not being aware that you were fasting and you had drunk water. So it's very important to differentiate between forgetfulness and the accidental nature of breaking the fast. Coercion, for example, somebody is forced to break their fast under coercion. Somebody is threatened with their life and they're asked to eat, that would nullify the fast. Sleep, ignorance, these are other categories that would not qualify as an absolving state. So I told you we in the medical field, obviously with the rapid technological advancement and the rapid advancement in medical science, there have been many issues that have been presented to the fuqaha that require understanding of these principles. And for example, recently we had the COVID swab, for example, whether the COVID swab would nullify the fast or not. Now, if we look at those principles, it becomes easier to understand how the mufti or the fuqaha would view the COVID swab with regards to it being a nullifier or not. So the ones I've listed here are all the topical ones, I must say, the ones where there are differences of opinion, and particularly why there's difference of opinion is because their modern understanding of anatomy and physiology have helped fuqaha understand whether the particular agent fulfills the criteria or the principles that I mentioned to nullify the fast. And with the advancement of understanding, things like urethral catheter, eye drops, medication put under the tongue, sublingual medication, examination, for example, a woman has to undergo a gynecological examination, therapies involving introducing drips, IV therapy, the asthma inhaler, epidural anesthetic also, interestingly, has also been a very topical issue with regards to how the fuqaha rule. So let's go through some of them. Let's start with the eye drops. Now, there are a group of ulama who feel that the eye drops used in the eye is a nullifier of the fast, and they cite the reason being that in the eye there is what we call a tear duct, or a medical term called lacrimal duct, that allows for entities that enter the eye cavity to get into the nose, and then we know from the nose things enter the throat. So based on this, they say this is a manfad, that the pore in the eye, or the punctum we call it, or the lacrimal duct, is a manfadul mu'tabar, or a qualified passage, and therefore eye drops would nullify the fast. This is one group of scholars who mentioned this. Another group of scholars say, no, it's not a nullifier of the fast, because the lacrimal duct is so tiny, it can be considered like this, the pores on the skin. And we know that the pores of the skin, although they are minute openings, they are not considered as an al-manfadh al-mu'tabar. Secondly, these scholars also quote the hadith of Rasulullah sallallahu alaihi wasallam with regards to using antinomy in the eye, which does not nullify the fast. And then there's also this concept of the amount being qaleel. So they get this concept from the use of miswak, and some of the chemicals that are released from the miswak that do go down into the throat do not nullify the fast. Based on this, they also offer this as an explanation to why they feel that eye drops does not nullify the fast. Again, I'm not going to issue my verdict on this, but this is how I just wanted to bring it to your attention how the ulama or the fuqaha would now use the principles to rule in this contemporary issue. Just to give you an idea of what I was talking to you just now, is that there's the lacrimal duct, if you see there. So at the corner of the eye, you've got a canaliculus, all these big names, but anyway, the passage that goes all the way down is communicating with the nose, as you can see. And we know that the nose communicates with the throat. So that is with regards to eye drops. So the next contemporary issue and contentious issue with regards to medical therapy is the asthma inhaler. So there are a group of scholars who feel that the asthma inhaler is a non-nullifier. And they base their dalil or their proofs on the fact that whatever we inhale does not enter al-jawful mu'tabar. They feel that almost all the medication that is inhaled goes directly into the lung. And because of that, it's not entering al-jawful mu'tabar, and therefore the fast would not break. They also suggest that the medication that is inhaled, even if it does enter al-jawful mu'tabar, is qaleel. It's a small amount, a negligible amount, as we spoke about the concept of qaleel early on, and therefore, based on that, it would not nullify the fast. And then we have got the group of scholars and fuqaha who feel that it is a nullifier, and their argument is that the medication does enter the throat, because the two passages, and I'll show it to you, lie very close to each other, and the throat referred to by the fuqaha is what we call the oropharynx. The oropharynx is an area that is just above the air pipe over the trachea, and inevitably medication has to land there first and then enter the trachea. So it is entering al-jawful mu'tabar. The entire dose somehow does enter there and enter the trachea. And finally, these fuqaha also say that that amount that lands there is significant. And they've shown with studies that when we use an asthma inhaler, a lot of the medication goes down into the stomach. As I mentioned, that this is the anatomy of what we call the pharynx. So as you can see, we've got the oral cavity there where the tongue sits, and the blue area called the oropharynx is the throat, or the al-jawful mu'tabar. The fuqaha mentioned that the throat is part of the cavity of consequences, and they're talking about the oropharynx. Why they talk about the throat being a cavity of consequences? Because if anything lands in that area, there is a reflex that's triggered, and this reflex has got nothing to do with our voluntary control. So if we put a morsel of food into that area, automatically the brain triggers off a reflex that allows for swallowing, and this reflex causes what we call the epiglottis to close. The epiglottis is a flap that closes the windpipe. If that doesn't close synchronously with that peristaltic movement, we will all choke and die. So Allah has created a system where once a morsel of food enters the oropharynx, there's an automatic reflex for the epiglottis to close, and an automatic reflex called peristalsis that causes the morsel of food to go down the esophagus. So because it's a situation where this cavity is hidden, so once the qualified agent enters there and there's no way of getting it out, and it goes down into the stomach, it's considered a jawful mu'tabar. This is very interesting. So we have what I've listed as neuro-related procedures. Neuro-related meaning anything related to the brain and the spinal cord. And interestingly, the fuqaha of earlier times and their understanding of medicine, their understanding was that there was a communication between the the brain cavity and the spinal cavity, and what we know today as the alimentary tract that we described, the throat, stomach, rectum, that tract, or al-jawf al-mu'tabar. So they were convinced that there was a communication between the brain cavity and this cavity, and therefore they have stipulated, the fuqaha of the past have stipulated, that anything that enters the brain cavity would nullify the fast. And right up till recently, there are contemporary fuqaha that rule on this, that anything that enters the brain cavity, and in our current times, a good example is epidural anesthesia. So if a person undergoes surgery in the lower part of the body, generally undergo what we call spinal anesthesia or epidural anesthesia, where medication is introduced into this cavity through the spinal column. And there are other procedures that get done with regards to the brain. So it did obviously become a contemporary discussion. And there are ulama who have now understood the current medical knowledge and medical anatomy, or the current knowledge of anatomy, and have ruled that neuro-related procedures would not nullify the fast, because the brain cavity is not considered a qualified cavity, or al-jawf al-mu'tabar. Just to give you an idea of what I was talking about, that's the cranial cavity and the spinal cavity, and you can see the other cavity. There's no link, there's no communication between the cavities in the body that we speak about. So, the previous understanding of medicine and at the time of the fuqaha of the past was that there was a communication between the cavities. We spoke about ear interventions. Again, there are a group of ulama who feel that obviously the entry of any substance or a qualified agent would nullify the fast, but with current medical understanding, there is no communication between the ear canal, or we would talk about the outside ear passage, and the eustachian tube that connects to the throat, unless the tympanic membrane there, or what we call the eardrum, is perforated. If the tympanic membrane or the eardrum is intact, it's impossible for anything from the outside to enter down the eustachian tube into the throat. And therefore, contemporary fuqaha have ruled that if the eardrum is not perforated, the use of eardrops would not nullify the fast. Urological intervention. This is something that's close to my heart because I practice as a urologist. And the common question we do have is that anything inserted into the urine passage, will it nullify the fast? So we do scopes, we do catheters, and also we insert medication into the urine passage. And again, based on understanding of medical science at the time of the fuqaha, and particularly Imam Abu Yusuf, whom the fatwa was based on, he felt that the fast anything entering this passage would nullify the fast. Again, the understanding was that the urinary tract was communicating with the GI tract, and therefore the ruling was as such. However, current medical knowledge tells us that there is no communication between the urinary tract and al-jawf al-mu'tabar, and this should not be a nullifier of the fast. So we have situations where people have what we call urine retention. So they are unable to pass urine, and they need to have a catheter inserted. The common question is, Mufti Saab, can we have a catheter inserted? Or you need to have an urgent scope procedure for somebody who's bleeding, and can we have a scope done? So these are common questions we get asked on the medical side. With regards to gynecological intervention, the same issue arises, is that the fuqaha understood that the female genital tract was communicating with the al-jawf al-mu'tabar, and therefore anything that entered the female genital tract would nullify the fast. And this is also another contemporary question that if you look at the different rulings, there are some ulama who still feel that this would nullify the fast. But currently, with medical understanding, and because this is an ijtihadi issue, we understand from medical science that there is no communication between the female genital tract and al-jawf al-mu'tabar. And therefore, it should be a non-nullifier. Anything entering the genital tract should not nullify the fast. It's important at this point I do mention that I'm just purely mentioning if these things were to happen or these things are required as an emergency. this concept that we don't necessarily do these procedures in Ramadan is the best way to stay out of any doubt, that we should plan all elective investigations and medical treatment outside the fasting period. However, we have many situations where these are emergency requirements and people want to know whether their fast would break or not and whether they can undergo these particular interventions. Just to give you an idea that the female genital tract has no communication with the rectum, which is the al-jawf al-mu'tabar, or higher up either. The next topical and contemporary discussion with regards to fasting and medical fiqh is the concept of injections. And there's different types of injections. And so when people talk about drips and injections, people have this concept of one injection. But I've put up this slide just to show you that we have up to 4 different types of injections. So we have an intramuscular injection where the injected item goes all the way down into the muscle layer. Then what we have is called a subcutaneous injection where the diabetics inject the insulin. It's just into the subcutaneous, the layer under the skin. And then we have what we call intravenous injections. That means we put the needle into a blood vessel, particularly a vein, and we inject medication or whatever needed to be injected into the vein directly. And then we have what we call intradermal injection. This is directly into the layer of the skin below. And we have a few other types of injections, intra-articular injections, that means into the joint spaces. I spoke to you about epidural injections, injections into the spinal cavity. So it's just important for us to understand that there's just not just one type of injection. Again, this is not so contentious because there's no obvious cavity we're talking about here. But the discussion in contemporary fiqh deals with regards to the issue of salah badan, that means giving quwwah, giving strength to the body and defeating the purpose of fasting, and whether this would be considered a nullifier of the fast. So obviously injecting into these various areas of the human body does not enter al-jawf al-mu'tabar. It doesn't follow necessarily a passage. Maybe the drip may have a manfath. But on the whole, these things do not follow the principles that I mentioned before, and therefore they should not necessarily be nullifiers of the fast. And so, if you look at most contemporary fuqaha and fatwa today, injections do not nullify the fast. However, there is recent discussion because it's become a trend now, I've been told, that people at the end of the day have a vitamin injection to give them strength to carry on the fast. Some people also go to the extent of putting up a drip to allow them to continue their fasting. And so this is an area where some fuqaha are beginning to rule with regards to this also being a nullifier of the fast. So alhamdulillah, my presentation was mainly getting you to understand the machinery in the mind of the fiqh and how the mind of the mufti or the fuqaha work when arriving at an answer with regards to the invalidators of fast. And it's not just a thumbsuck. However, there's many other issues that require attention with regards to fasting, and I just put them onto a slide. So we've got patients that have chronic conditions like chronic respiratory disease. People have asthma, emphysema. People come to us with chronic heart diseases. They're on medication and they want to know whether we should be fasting or not fasting. We've got patients who have chronic renal disease that are on dialysis and they want to fast. They want to know what the obligation of fasting is on them and that sort of thing. We've got people who are immunocompromised, people who have arthritis and are taking high-dose steroids. We've got patients who have chronic mental and severe mental illnesses, from depression to schizophrenia to psychosis to anxiety. So these are the different aspects that need to also be addressed, but it's not the scope of this discussion today. But I thought I'll bring it up here and to tell you that, alhamdulillah, this is why it's important that the medical experts have a very close dialogue with the fuqaha when rulings are made with regards to fasting. And finally, I just summarized this slide here, and we'll run through it quickly. So the ones we spoke about, and agent meaning a qualified agent. So we look at things that are done on the skin. For example, people ask you about acupuncture. Would that invalidate the fast? If I use creams and lotions, would it invalidate the fast? So as you can see, I've got there no, no, and yes. For example, gastrostomy I spoke about is where we insert a tube directly into the stomach, and we know that it is invalidator of the fast. So this slide is fairly self-explanatory. The things that do nullify the fast and don't nullify the fast. And in red, obviously, I've highlighted the areas that give us a sense of there being a difference of opinion among fuqaha, and we spoke about why there's this differences of opinion. Like we've got the ear drops, the nose drops, the eye drops, the urogenital tract, suppositories, gynecological examination. Now, the circulatory system is becoming an area of more discussion amongst the fuqaha, especially when it comes to nutritional IV fluids. It's become a fad now that people have vitamin infusion, and whether vitamin infusion or glucose drip infusion would nullify the fast, and things like dialysis and that sort of thing. So I'll end here, inshallah. It would have been nice to have an interactive discussion with regards to this, and if we do have time, we could go through scenarios that do impact the fasting person from a medical aspect. And alhamdulillah, we've got ulama here also who can help us make some comments with regards to any questions that people have. Jazakallah khair for listening. So if anybody has a question online, please enter it into the chat box, and maybe inshallah we'll try and answer the question via that medium. And those who are in the audience also, we could have a discussion, inshallah. Right.
Blowing air into but sometimes it has a humidifier with it attached to it.
Right.
Would that break the fast, or would that
Inshallah. So I obviously will give you what the principles of fuqaha use, and then with regards to issuing the fatwa, maybe we can ask our mufti sahab. So basically, we looked at those five, and I'll go back to that slide. So we have these five entities. So you have to look at it. So the question, sorry, for those who are online, is that whether a CPAP machine that people use for sleep apnea at night, would that nullify the fast? So the CPAP machine, from how I understand it, it is blowing in positive pressure air to keep the airways open. So it's pushing in air. Now, when the fuqaha look at it, is whatever is entering the passage, and also potentially al-jawf al-mu'tabar, being the throat, does it qualify as a qualified agent? Now, we said that for something to qualify as an agent, it has to be solid, it has to be liquid, edible, non-edible. It has to have also a body or a form. If you have an entity that you can't see, it's non-tangible like air, that would not qualify as a qualified agent. So potentially, the air that is being blown in is like breathing in air. It does not, or any gas that it does not have a bodily form to it, would not qualify as a qualified agent. So from my understanding, if this machine is purely pushing in positive pressure air and has no additives to it, no medication or water for humidification, then it would not qualify as a nullifier. However, if you're saying that this positive pressure air that is being pushed in is attached to a humidifier, and now there's water droplets that are added to this air, then that becomes an issue, because the water droplets in that air would then potentially be a nullifier of the fast.
You're in the same room with the humidifier, but the humidifier is not very close to you, it's somewhere else in the room.
That's fine. So as I mentioned, that would fall under technically we are all breathing in humidified air. If you're sitting in an aircon room, so that is arduousness. I spoke about the issue of arduousness. It's impossible to avoid. Enter a room, there's bukhur, and we are all inhaling it. So it's not a thing that you are intentionally inhaling.
Where are you putting it on intentionally?
Yeah, it's a good question. You're putting it on intentionally, but still, you're putting it intentionally in the room. You're not specifically putting it so that you're inhaling it. So for that matter, everyone's fast would break if it was that situation. So yeah, I don't think it would fall. But Mufti Saab obviously our muftis can rule on that with regards to looking into it more. But I doubt, because it's not something that you're doing specifically for yourself to inhale it with an intention to heal it also.
With regard to the eye, you said that the manfaat is insignificant. Right?
Yeah.
So generally, is it possible for when a person applies eye drops
Yeah.
for him to taste?
Yeah. So that's
If he tastes it, then
Yeah.
we say the fast is definitely broken, or it's still.
Yeah. So generally, this is the question that gets asked to the ophthalmologist, that the doctor, I put the eye drops and I can actually feel it, and they do. You do feel the substance at the back of the throat. So there's two ways to look at it. So firstly, if you follow those who feel that it's not a nullifier of the fast, even if it enters through that and it's not a manfad al-mu'tabar, it's not going to break your fast, even if you can. So that's that group of scholars, because they don't consider this as a manfad. It's like putting lotion on your hand and it's going into your, getting absorbed. For those who consider it to be a nullifier, but they consider that amount that is entering the throat is in the upper oropharynx. It's in the nasopharynx. It's not necessarily in the. That's why I showed you that diagram. It's the oropharynx that is considered the throat. The blue area is considered the throat. Now, generally, if you put something into the nose, it gets into what we call the nasopharynx, and very little comes on. So the element of qaleel comes in. So you do have the taste. The fact that you get the taste means it's coming into the tongue area. You cannot taste anything in your throat. There's no taste buds in the throat. That means whatever is coming there comes into the nasopharynx and then comes into the area of the tongue. So it's generally considered qaleel, almost like use of miswak, and based on that, they would say, it's a non-nullifier. Again, when it comes to all these things, the safer option is to put your eye drops before suhoor and put it after iftar. But, it's important we have this discussion, because if sometimes we have patients who require putting drops in their eyes 2 hourly to keep their eyes from drying out. So it's important, we discuss this.
Common question
in
regards to pap smear.
Right.
And previous view of it reaching the stomach, etc.
Yeah.
area. How do doctors view, or is there unanimous view in terms of anatomy that there's no connection between the farj and the bottom? What's the doctor's view?
Yeah. So if you use the definition that I used, so the definition of al-manfadh al-mu'tabar is primarily the alimentary tract. That means the tract where food gets absorbed. That means it's from the, as we mentioned, the oropharynx all the way down to the rectum, and this is the lining that food actually gets absorbed. There is no communication between that passage and the farj. There's no communication between, so obviously the female genital tract totally has no communication with it. The female genital tract enters into what we call the peritoneal cavity. The peritoneal cavity is a potential space in the abdomen that's got, it's basically the organs lie in this area. But the actual cavity that we talk about, the al-jawf al-mu'tabar, runs within that cavity. So it's got no communication with that cavity. So I know some people say, but it's getting into the peritoneal cavity, because from the uterus into the fallopian tubes, and then we run into what we call the peritoneal cavity. But there's definitely no unanimity. There's no communication between the female genital tract and the al-jawf al-mu'tabar or the alimentary tract. There's no communication. So the question was whether there's a woman undergoing pap smear, whether there is communication or would become a nullifier of the fast. Obviously, contemporary understanding of anatomy would tell us that there's no communication between the genital tract and the alimentary tract or al-jawf al-mu'tabar, and therefore it would not be a nullifier of the fast, purely based on those principles. But again, same, if you can avoid it, an elective procedure, having a pap smear can be delayed for after the fasting period, then it should ideally, to stay out of the ikhtilaf, be done at a period where it doesn't compromise our understanding. But according to the principles, and in fact I've seen a lot of contemporary fuqaha now have ruled that having any gynecological procedure would not nullify the fast.
The food and drink is not considered, and also
spouse also not Muslim.
Yes.
So, wouldn't the Practioner possibly be a breaker of the fast, looking at this perspective? There's no nourishment that's taking place.
Yeah, so that's a different entity. So that's a different category of nullifying. I didn't discuss that. Sexual activity is a break of a fast on its own, not because of this. Mainly, we discussed when it comes to the the ruling with regards eating and drinking. So those eating and drinking is what we obviously are concentrating on, even from a medical side. With regards to jima and sexual activity, that is a nullifier of the fast on its own, as an own entity. So it's got nothing to do with the nourishment or anything like that. Just the activity itself would nullify the fast.
The IV drips, how do the doctors view that in terms of the entrance into the body, cavity, passage?
So technically, from the definition I've given you, the circulatory system, as we call it, that means the blood vessels that house the blood. So blood is running in the blood vessels. They have no communication directly with al-manfadh al-mu'tabar or the qualified cavity. That means the throat, stomach, and intestine. But what we do know is the whole objective of the manfadh al-mu'tabar is to provide nourishment for the bloodstream. So whatever is absorbed from the intestines or the stomach ends up in the blood, and that's why we get nourished. And that's why the contemporary fuqaha are now looking, because the whole purpose of eating is to get nourishment into the blood system. So shouldn't the blood system also be considered a jawf al-mu'tabar, not a manfa, a jawf al-mu'tabar? If it does, which some are obviously arguing it should, because that is where the ultimate end of the nourishment is, and it gives us the strength, then inserting a IV line becomes a manfadh. It's an opening to the outside, so it fulfills the al-manfadh, and whatever you put in is the agent, and it fulfills all the criteria. If you consider the circulatory system as a al-jawf al-mu'tabar, then, and it's becoming more and more a question, because as I say, it's becoming a fad now for people to have IV drips or for energy, vitamin drips, nutritional drips, and whether that should be considered a nullifier. Currently, I haven't seen any mufti ruling on it being a nullifier, but I think it's a discussion to be had amongst the fuqaha, whether, because it's going against the purpose of fasting. The purpose of fasting is to experience the hunger, the lack of nourishment, the weakness, and if you're going to circumvent it by having a drip and you're not going to have any of that, the actual purpose of fasting would then be lost.
Another common one is the person is traveling during the day while fasting, and they've got to take certain medication, to make themselves comfortable on the plane. So sublingual medication.
Yeah.
How does that?
So sublingual would not be a nullifier. So sublingual medication doesn't enter al-jawf al-mu'tabar, because it sits under the tongue, and all of it gets absorbed under the tongue, and it goes directly into the bloodstream. And so it wouldn't fulfill the criteria that we mentioned, those 5 criteria. So we have patients who take sublingual medication for chest pain, for heart conditions like angina. It's also sublingual medication. We get sublingual medication for pain now. So there are some morphine preparations that you can use under the tongue for pain. So yeah, so technically, and again, we get that ruling also. We know a woman is allowed to taste, food that she's cooking for her husband and that sort of thing. So anything that enters the mouth is not entering al-jawf al-mu'tabar, doesn't enter the throat, would not nullify the fast, purely by principle. Sorry? What is it? So it's medication that is prepared in such a way that allows the lining of under the tongue, the mucosa we call it, the lining under the tongue, to absorb it. If you put a piece of rice under your tongue, your body will never absorb it. But rice is made up of glucose. And if you take glucose, that means in its elementary form, and you put it on your tongue, your body will absorb it. So it's just how things are prepared, they are able to be absorbed. And we know that the medication gets totally absorbed at this level. So it's not necessarily entering al-jawf al-mu'tabar.
Is there any difference of opinion on that?
On sublingual medication, no. I think there's uniformity that if anything doesn't enter the throat, it would not nullify the fast. However, I can see now, again, like the IV preparation, people would now talk about people putting things sublingually to keep themselves nourished. And I think it's going to come that fuqaha have to rule on the fact that part of fasting is to remain non-nourished. Salah badan, is one of the objectives of fasting, and if we can, if people are circumventing, then there has to be a stop put to it. Then they would consider it as a nullifier. But on the whole, I don't think sublingual medication would, because we use miswak also, siwak, anything that's held, we gargle during wudu. So, generally those things don't break our fast. So any agent that enters the mouth, that doesn't enter the throat, shouldn't technically nullify the fast.
This one is IV thing, it's not related to the fast, technically, but you're saying it's becoming like a fad.
Yeah.
So in terms of its benefit to the body,
Yeah.
if people are doing it on a constant basis, is there an issue with that?
So obviously there's a very varied opinion on IV vitamins. Vitamins is what they use. And one spectrum of professionals believe that it's just making your urine expensive. It's because whatever you put in excess would come out in your urine. And we see that your urine changes color when you have excess vitamins. And that makes the most sense, that the body only needs vitamins in minute quantities. You'll see, you'll pick up any package, the recommended daily allowance, they'll show you. It's minute quantities. And if you give your body anything in excess, one of two things can happen. The excess will get passed out by your body via your urine, or it will cause damage by getting stored in an unnatural way. And we have that situation. So people who have excessive iron, it gets stored in iron and causes damage to organs. So that's the one opinion. However, there's also opinions that, we're not getting enough vitamins in our food. Our food is, poorly nourished, there's poor nutrition in our food, and therefore we need these vitamins. So that's an opinion. But realistically speaking, we don't need so high doses. However, there is a need for IV sort of nutrition in patients who generally have deficiencies. So you have people who have vitamin B12 deficiency, for example, they need a drip. People who have genuine deficiencies, and then people who are also hypoglycemic, that their sugar levels have gone down, you need to put up a glucose drip and get their sugars up. So there is a place, but currently how it's been done and advertised, and particularly because it's been done by celebrities around the world, and there's lots of claims around it, so it's created a sort of interest among people. I hope that answers the question.
And that passage we said is manfal, right?
Yes, the rectum.
The rectum.
The rectum, not the anus.
Right. So that means if a person is washing that area, is it possible for any water to go up?
Yeah, so basically, if the sphincter is closed, then water generally shouldn't go up beyond into the rectum. And generally that shouldn't be a nullifier as far as long as water doesn't enter into the rectum, and generally it shouldn't, because the area we're cleaning is generally in that area of the anus.
So generally when we speak of istirkha and mafasid,
Yeah.
so if a person is washing,
Yeah.
that is the case, there is istirkha, right?
Yes.
Would that allow any water to go up?
Yeah, it won't, unless you actually make it an actual event, or you actually put a tube up beyond the sphincter, which is about 2 or 3 centimeters, like how you put a suppository or an enema. You put it beyond that, and then you shoot water in. So it's very unlikely, because that area is. They do speak, I know in the Fiqh course we did, is that they speak about if your fingers go too high up, and you enter the rectum and you've got water on your finger. But then I would think that is negligible. That is again qaleel. I mean, it's not like.
So that will be the next thing, that the moist could be absorbed into that area.
Yeah.
After washing, the moist
Yeah.
also will be regarded.
So the moist would be absorbed only in the anal area. It won't go up because it's a watertight. Interesting, you speak about separate totally, but when you look at the anatomy of the human body and physiology, Allah has created it. It's one of the sphincter mechanisms that is unique. It has a capacity to allow air but not allow fluid. So we release wind. Imagine if that sphincter opened and everything came out. But Allah has created such a sensitive sphincter it is, that it allow air out but it won't allow liquid out. It will allow air out but it won't allow solid out. And when we need to, that's how sensitive that sphincter is. It's quite a sensitive sphincter. Gee, I don't know if there's any questions on the chat. Anybody that's online that has a question? Oh, there's a question here actually. Can you retrieve the questions for us? There's a question here. How do you get these questions? Okay, so there's a question here. From my weak understanding, the fuqaha seem to have regarded the womb. Oh, it's further up. That's the first question. Okay. MashaAllah, very informative. What is the line between significant and insignificant, qaleel and kathir? And from my weak understanding, the fuqaha seem to have regarded the womb as a jawf mu'tabar. See Fathul Qadir, wherein he uses hukna as a maqis alayh and mentions the aspect of tajahdub. Yeah. As I say, these are discussions for fuqaha to have. And many of fuqaha, in fact, also with regards to the urethral passage, Imam Abu Yusuf also mentions the fact that, anything entering the urethral passage as opposed to Imam Abu Hanifa himself would become a nullifier of the fast. These are ijtihadi issues, and I think with modern understanding of, anatomy, I think the fuqaha of the time need to look at it and decide whether there's a need to move away, or not necessarily move away, but to apply principles to adjust the fatwa on these issues. The next question, the minimum amount regarded in rectal insertion is qadrul hukna. That answers your question, qadrul hukna with regards to the enema. But again, with regards to qadrul hukna, how much is qadrul hukna? How much of the enema is inserted? So I know this concept of rectal insertion, which is allowed to the aspect of qaleel, but I'm not sure what is qadrul hukna, how much is qadrul hukna. There's no specification on exactly what qadrul hukna would be. But there's a valid contributions there from one of the guests on our online platform. Yeah, and by the way, if anybody wants to, share something that I may have misrepresented or something that I can learn from, please do inform me. This is all a learning process for me, alhamdulillah. I'm also in my infancy in learning this aspect of fiqh, and I'm sure many of you would have ideas that are relevant and I can learn from you. So please share these aspects with me. Jazakallah. I don't see any other questions here. Ji.
Burning old or things that have smoke,
Ji.
have a perceptible body. How does
Yes.
that work in terms of
Yeah. So basically, the fact that it will be considered an agent of consequences, or it would be considered an agent that would break the fast. So what we look at is whether it will enter al-jawf al-mu'tabar. And generally, when you inhale, it will enter that first part of the oropharynx. And based on that, smoke is considered a nullifier of the fast. However, if you're smoking unintentionally or inadvertently, or you enter, as I say, the aspect of arduousness where you can't avoid it, which I think, like for example, if you enter the masjid and they've got bukhur, then that wouldn't be considered a nullifier based on the fact that you've got a mania, that it's arduousness, that it's unavoidable. But why smoke becomes a nullifier, and that was always the question I also had, is that as opposed to, we can understand edible things, soluble things, but how does smoke become a nullifier? And based on this is that it's got a perceptible body and it enters into al-jawf al-mu'tabar, which is the throat before it goes down into the air pipe. And also some of it does enter down into the esophagus, into the stomach. So based on that, the fuqaha have ruled with regards to smoking.
Steam would be the same.
Yeah, because steam's got water in it. There's water content.
Showering, very hot water.
So I think their arduousness would be the issue. It would be a mani. Yeah. No, so accidentally also will break your fast. If you inhale smoke, so the accidental one is the issue. But if you're in a situation where you can't avoid it, so far, I think showering and steam is an unavoidable situation. You're going to have steam generation. So it would fall under a mania. But say you're working with something that generates smoke and accidentally you inhale smoke, then it would fall under accidental inhalation, and maybe, the fuqaha can then look into it and decide whether that would be, a break of the fast. But the general issue is you're walking past an area where there's a fire, there's smoke. It's not going to break your fast.
Thinking about it being directly administered as opposed to going into the air and then come
Directly administered,
one is smoking.
yeah, smoking it.
One is it's in the air and then
Yeah, so if it's in the air, as we said, it's unavoidable. But if you're putting it in the air and you are intentionally inhaling it, that would definitely, but if you just not directly inhaling it through your cigarette or the vape, but you're creating that smoke and you're inhaling, that's not considered a mani. That you intentionally going and you're inhaling it to get the smoke in. So that would break the fast.
so when you gargle your mouth,
Yes.
mix it with the saliva and you spit out whatever is there, but you can still taste a little bit of water that's mixed with saliva.
Yeah.
And if you swallow that with the fast break,
No. So all those things, like for example, saliva, we always, swallowing our saliva, mucus also made in the nose. Obviously, if you're making a concerted effort now to build up the saliva in your mouth and take it down to quench your thirst, or for that matter, mucus, you're building it up and taking it out so you can alleviate, then obviously those things would then start to be considered, and then you discuss it with the mufti. But then I think there would be a grounds for breaking of fast.
with regards to when you gargle your mouth,
Yeah.
and you spat out what you put,
Yeah.
but you can still taste some of the water in
Yeah.
your mouth, and you swallow that with the
Yeah.
saliva.
That would be qaleel, firstly, and also its arduousness. It's a mani. And Mufti Sahib can help us on that. I think it's an issue that you cannot avoid. It's same like miswak. Inevitably, if you use miswak, some of the miswak content enters it. And we know Rasul gave conjaish for that. Okay. جزاك الله سبحان الله وبحمده سبحانك اللهم وبحمدك نشهد أن لا إله إلا أنت نستغفرك ونتوب إليك جزاك الله خير. Wait, there's one more question. Sorry, Mafman. Does Maulana think that the humidification in sleep apnea apparatus can be considered as qaleel, or due to necessity of it, arduousness can be applied? It's a good question, actually. So I don't think it would be considered qaleel. Again, qaleel obviously becomes a very subjective issue, but it's a significant amount of water that enters. If you are running a CPAP machine, or for that matter, an oxygen machine with a humidifier, if you notice often the entire bottle, if you run it over a few hours, the entire bottle of water gets used up. So that's a significant amount of water that's used. So yeah, so I think it wouldn't be considered qaleel. Due to necessity, I think if it's due to necessity, then you become a person who the Sharia will allow you to not fast, because if you really require oxygen therapy for that matter, and it's obviously you go through the fact that it's for preservation of life and limb, and then you would fall under the category of being given leniency not to fast. If it's for that temporary period, then it would be qada would be required. If not, then fidya. So I hope that answers the question. Arduousness is not necessarily applied in the situation, because arduousness is very, unavoidable. In normal circumstances, unavoidable. I hope that answers that question, inshallah. Jazakallah khair. Assalamu alaikum.